Welcome, everyone. Thank you for standing by. All parties will remain on listen-only lines for the duration of today's call until the question and answer portion. At that time, please make sure that your phone lines are not muted. Press *1 and record just your name to be placed into the queue. This call is being recorded, so if you do have any objections, please disconnect at this time. And I'd like to turn the meeting over to your host, Ms. Michelle Carnes.
Thank you so much, Lisa. Welcome, everybody, and thank you for joining this webinar today for the application process for the Native Connections program. We are going to record this today, so if you have any colleagues that are not able to join us that you think would be interested, then you will be able to share this with them in the future. I'll tell you where they can find this link. Before we get started with the process, I'll just tell you a little bit about who I am and who it is that's talking to you on the phone here. My name is Michelle Carnes. I'm a public health anthropologist, and I work in the Suicide Prevention Branch at the Center for Mental Health Services here at SAMHSA, the Substance Abuse and Mental Health Services Administration. Native Connections is a new grant, and it is specifically designed for American Indian Alaska Native tribes and communities. This is the first round of funding, so if you haven't heard of Native Connections before, there's a good reason. It's because it's brand new. And I want to emphasize to you that this is really about systems change to benefit Native youth. And so rather than thinking about this as a project, I really want to encourage you to think of this as a long-term movement or an ongoing initiative to improve services in your community. So today, we're going to be doing a number of things. We're going to increase your understanding of the purpose and goals of the Native Connections Grant Program. I'm going to walk through each element of the RFA. I'm going to give you some additional background information and tips and suggestions, and we'll kind of go back and forth on those sometimes. You'll see those in italics. So every so often I'm going to pause and give you some tips and thoughts, some resources and ideas on the sections. And then at the end of each section, we're going to pause for a moment for questions just on that section, just so that we can make sure that we're clear before we move on to the next part. So here's the basics that you want to be familiar with for this program. On the page 4, there's an executive summary, and this is some of the most important information you'll want to be aware of. The application is due June 4th, so you have just about a month or so left to continue your preparation. We anticipate making up to 20 grants. They will be for $200,000 a year for up to 5 years. There is no match required, and the eligible applicants are federally recognized tribes, tribal organizations, and tribal consortia with an average 10-year suicide rate of 13.88 per 100,000 for youth aged 10 to 24. And we're going to talk a little bit more about what that means and how you'll calculate that rate. So in terms of eligibility, here's a little more detail. If you're any of the 565 federally recognized tribes, villages, if you're a tribal organization or a tribal consortia, and if you have the suicide rate that I described before, then you are eligible. If you are an urban tribal organization, you are ineligible. And for this grant, we use the definition from the Indian Self-Determination Educational Assistance Act. And so tribal organization means the recognized governing body of any Indian tribe, any legally established organization of Indians which is controlled, sanctioned, or chartered by such a governing body, or which is democratically elected by the adult members of the Indian community to be served by such organization, and which includes the maximum participation of Indians in all phases of its activities. And if there is a grant made to that organization benefiting more than one Indian tribe, the approval of each tribe has to be a prerequisite to that grant. So in other words, if you're a tribal organization working with a community or communities, then you must have their consent to do this work with them, and that will be part of the application process. So here's the first italic slide, which is the sort of background and tips and resources part. It's really important to understand what it is we're asking you to do. think about the general concept of the grant and purpose. You want to review the expectations and the required activities that are detailed in the RFA, and you want to look at the resources that are cited and think more globally about public health approach to suicide prevention, because that's going to give you some insight about the philosophy that underlies the Native Connections program, and that's going to take us into the next section. Make sure that you're ready to begin this work. Make sure that you understand what the goals and the purpose and the activities of this project is, and think about whether that fits with the goals of your community. Is this something that your community is ready to do? You want to make sure that your tribal leaders and program administrators understand the grant, and that they understand that that's going to promote community and systems change, and make sure that they themselves are committed to supporting it. That's going to make things a lot easier as far as getting this work done. And you also want to talk to people in your community, families and youth and service providers and other community leaders, to gain their input and support and assurance that there is just a general community readiness to do the work of this grant. So when you're writing your application, you want to make sure there are some things that you don't want to stray from. You really want to strictly follow the instructions in Section 4, which is the application and submission information. And in your narrative, you want to follow Sections A through D as the headings and the format. And each of the bullet points should guide the body of your narrative and sort of help you tell the story of your ideas. You want to be very clear about the bullet points in those appropriate sections and what they're asking you to do, because if you don't address those things, then the reviewers can't give you points for that section. And you want to make sure that you've got the information where they are asking you to put it, because it won't matter how compelling your story is if you put the reviewers in a position where they can't give you points for the information because it's not where it needs to be. You want to make sure that you review Appendix A on page 25. Make sure you've followed all the formatting requirements on the checklist. So these are just some things to keep in mind, just some pointers to keep in mind. The resources are there for you in the RFA to help you do this. So now let's get into what this grant is about. So it's got a very clear purpose: to prevent and reduce suicidal behavior and substance abuse among American Indian and Alaska Native young people up to and including age 24. It's to reduce the impact of substance abuse, mental illness, and trauma on American Indian and Alaska Native communities through a public health approach, and I'm going to get into that a little bit later on. And the focus is also on allowing American Indian and Alaska Native communities to support youth and young adults as they transition into adulthood by facilitating collaboration among agencies. So we know that this is a special time when American Indian and Alaska Native youth are going into adulthood, and having the supports and the coordination in place to make sure that they make that transition is really crucial. So here's another bit of background for you. And those of you who have worked in grants before, this may be familiar to you. Sometimes there's a approach to youth in the system that doesn't work too well, and so some of this may resonate with you. Sometimes programs put youth in a position where if they need services, they are passive recipients. Sometimes there end up being standalone programs that don't work together. Sometimes the people who run them are positioned as experts, and then they're supposed to assess the problem and direct the treatment, and they're supposed to plug the youth into the slots of the existing programs. And sometimes there's lack of clear expectations and reliability across the components in the system. And so what ends up happening sometimes is that the youth fall between the cracks. And so you can see a number of elements there that are often common things in communities where youth may be coming into contact with that system, but unfortunately those systems don't tend to talk to each other. And so some of what this grant is intended to do is address that. So just to give you a feel for where Native Connections is coming from in terms of its design and intention, we've placed a really heavy value on community involvement and feedback. It's a strengths-based program. It's grounded in community readiness, which is going to look different for every community that does this. Everyone's not at the same place with this, and so we really want to meet communities where they are with whatever's going on for them at that point. We want to identify what the gaps are and think about what the solutions could be, including innovative solutions that are going to be tailored to your community if those are things that work for you. This grant is intended to lead coordination across the agencies in your community, fostering relationships, again, a focus on innovation, and you have support through an American Indian Alaska Native Technical Assistance Center, and you will also be evaluated for your effectiveness in saving lives because that is ultimately the goal of this grant. So I'm going to describe for you a little bit of the year one activities. If you've taken a look at the RFA, then you'll see it's written maybe a little differently than other grants that you've seen. And we place a big emphasis on the activities that you're going to propose to do in year one. And so we've provided some examples of things that you'll want to consider as potential things to focus on. Obviously, the first thing will be hiring. How are you going to involve your community? There's going to be a readiness assessment to determine where your community is at in terms of readiness and capacity to address behavioral health issues. You're going to develop policies and procedures, standards of care for youth, effective transitions between the care, and then you're going to think about what is the role of traditional healing and what's the role of Western medicine and approach to mental health. So these are really the things you're going to be focusing on in year one. And then in years 2 through 5, you're going to decide which levels you want to focus on in terms of universal, selective, or indicated. And if you're familiar with the public health approach, then these will resonate with you, and they'll make a lot of sense. But I'm going to go into what they actually mean on the ground as far as what do these 3 levels mean for you. So after you've done this groundwork in year one, because that's really what that is. That's foundational infrastructure development, so that when you implement things in years 2 through 5, you have a really good foundation to build on. So let's start with universal. So universal means any kind of activities or initiations or efforts that are really focused on all the young people in your community up to age 24. And so this is where you might be doing things like engaging with schools, or community settings, like boys and girls clubs are also really common places. You want to have things that embrace cultural values and traditions, community events, GONAs, you may be familiar with that, the Gathering of Native Americans. And you may be working with existing programming with youth and building in behavioral health. So for instance, something that's already going on, a sports program or a camping trip, something like that, where you want to implement some behavioral health work into that. And that could be a universal activity, could be something that all the young people in your community up to age 24, regardless of their risk. But selective is when you target access and activities for youth that are up to age 24 that are identified as being at risk. And so this is where you're going to connect youth in crisis with the resources. You're going to collaborate with the partners across the systems to make sure they get what they need. And you're going to do assessment and connection to make sure that they get where they need to go. And so after you've identified some youth that need some help, you're going to take these steps to make sure they get what they need. But then the level of indicated is young people who have attempted suicide, who we know abuse substances. These are the youth that are going to need follow-up services. We want to make sure their subsequent needs are met. We want to make sure that recovery support services are in place and that lethal means restriction policies are in place for them, because we know that these are youth that need that help. And so indicated means that this is a very specific subset of the selective, which is also a subset of the universal. So you can see the butterfly metaphor that I've used in these slides is that the universal is the whole sky of monarch butterflies that are age 24 or under in your community. But then selective is just the youth that are identified as at risk that we want to make sure they have access. And then indicated are those young people that we know have attempted that abuse substances that we know for sure we want to make sure that they're in contact with services. So how do we know that these efforts are working? Well, there's a number of elements that we're going to be measuring for your program that we want to know more about, that we want to track on and see how well is what you're doing working for your community. Because as I said, there's going to be a variety of approaches and lots of different things that work differently across communities, but ultimately what we're trying to accomplish is the same. Every community is going to have their own approach to this, and there's going to be similarities and differences, but ultimately we want the same outcomes. And that is, we want to see that there's new policies between organizations, new collaborations as a result, that maybe there's new data being collected by organizations on behavioral health for these young people. Are you making new contacts as a result of your new efforts? Are there new services available? Are there youth that are receiving follow-up care, and how many are there? Have you reduced the amount of substance-related emergency room visits? How is your rate of underage drinking affected by the activities you're doing? And are you reducing attempts and completed suicides? Because ultimately that's what this grant is about. So these are the kinds of things we're going to want to know about, and that's the kind of information that's going to help you do a better job with your program. So our local performance assessment is really about, are you reaching the goals that you set for the grant? Are your activities having the impact you wanted them to have? And is your community readiness rising? Are people much more able to respond to the need? Is there much more of a willingness? Are you seeing that people are getting involved? And then are you seeing where you might need to make some adjustments to your project? So it's really designed so that you can learn about what's happening in your community and track on the progress that you're making so that you can have the best and most effective program possible, even if it looks very different from another program in the same grant. So, Lisa, I'm going to pause for just a moment here and just see if there's any questions about what I've covered so far, the purpose of the grant, the expectations, the values of Native Connections, eligibility, and then the ways that we measure progress.
And again, for those of you that do have a question, make sure that your phone line is not muted. Press *1 and record just your name at the prompt. We'll give it just a moment.
Thanks.
And also, just as a reminder, at any time throughout the call, you can press *1 and be placed into the queue so you can ask your question when she's ready. And it looks like we have no questions at this point.
Okay. Well, and that's not to say that if you think of something later, you can't email me or put it in the little Q&A box. You can certainly do that. So this isn't your only opportunity, but we will be pausing throughout just to check in. And this is the basics of the grant, and so typically, you know, this is sort of the beginning part. So as we get into the nitty-gritty here, you may find that you have questions. So if you think of anything, just jot anything down, and we'll just continue with the webinar.
Michelle, we actually do have two that just popped in now.
Oh, awesome. Okay,
hold on 1 minute. Let me get their name.
Okay, great.
Isla, your line is open.
Hi, my name is Isla. I'm calling from Native American Health Center in Oakland, California. And I did have a question about eligibility. We're a designated tribal organization. Does that mean that we would not be eligible to apply?
If you're a tribal organization, by the definition that act delineates, and if your tribe is in agreement that they want to do this work with you, then that tribe is eligible to apply. And if they designate you to be the point of contact for putting this project together, then you're eligible. So as long as you meet those criteria, and you know your organization better than I do, as long as you meet the tribal organization criteria, you're eligible.
So it is tribe-specific then? Well,
you have to say what communities you're working with, because you have to have a suicide rate. You have to tell us what the suicide rate of the community is for us to be able to work on a community solution to that issue.
Great. Thank you so much.
Yeah. Okay.
And Debbie Evans, your line is open as well.
Thank you. My name is Debbie Evans, and I'm in Kamiah, Idaho. I have a couple of questions. Is the PowerPoint going to be available for us to access online and print for future reference?
It will. I actually mentioned that at the very top of the webinar. It will be at this website, sprc.org, and that stands for Suicide Prevention Resource Center.org, and you'll see a tab that says SAMHSA Webinars, and right about Monday or Tuesday next week, this should be the very top one.
Okay, that's my first question. My second question is I have pulled up the RFA, and I want to make sure that I have the right one because on the RFA it says the application is due on June 17th, not June 4th.
Yeah, I want to make sure you have the right one too.
It's the Native Connections one, right?
Yeah.
93.243.
Thank you very much. You know, what that means is that we were able to get additional time for you, and that's very good news. So thank you very much. They must have just done that. I really appreciate you letting me know. That's really good news. Thank you.
It is due the 17th and not the 4th.
Correct. Thank you. And I will correct that throughout the webinar now. Thank you.
Okay. Thank you.
And I'm showing no more questions.
Okay. Well, those were good ones. Thank you for that. All right. So speaking of due dates, let's talk about the application and the submission information. And this is something that if you've ever applied with us before, then this is going to be very familiar to you. You'll recognize the information in this section. Okay. So in order to submit a grant for SAMHSA, you do have to go through grants.gov and the SAMHSA website to get the application materials, which our second person with the question has already done because you learned that we have this extra time for the due date, which is great. You want to download the required documents for that grant, and you want to make sure that you've got the electronic grant submission process down because there are a number of steps, so you want to make sure you're familiar with what all those are so that you're prepared with the pieces of information that you need to have, and there's that link right there for you. So these are the required application components, which probably look familiar to you. It's an application for federal assistance. There's a basic cover page. You're going to provide us with an abstract, a table of contents, your budget, the project narrative, which I'm going to get into detail here in just a moment. There's some attachments. There's some assurances, disclosures, checklists, things like that. So you want to make sure you're including all of those things with your application. There are some formatting requirements. You want to make sure that you've got everything correct as far as your font and your size. You don't want to be disqualified from the process because your font's too big or something like that. So that would be pretty silly if you worked really hard on it. So make sure that the formatting is correct. Your applications are due on June 17th, 2014. Yay! Now, if you submit it on June 4th, then that's great. You're early. That's wonderful. We encourage that. That's a good idea. But you do have until the 17th, which is wonderful. You want to refer to Appendix B for the guidance for electronic submissions of applications. However, if you want to request a waiver and submit a paper application, that is an option for you as well. If that's something that you need to do, that is something that you can do. So you can apply for a waiver. It's an extra step. We prefer that you do it electronically, but if you need to do the paper route, that's okay. Okay. Again, don't put it off. And if you do it on June 4th, we won't be mad at you. That's a great idea. But you do have until the 17th. There have been, and this is a sad, sad thing, and I don't want this to happen to any of you. There have been applicants who experienced a glitch. There was a rush at the end to put in the application, and then they missed the deadline, and they were not able to get reviewed as a result. Even though their application was all done, because of a technical difficulty, they just weren't able to get it in before the due date. Don't do that to yourself. That breaks my heart. It makes me upset, and I really don't want that to happen to you. So we suggest that you put it in at least 3 days prior, just so that if there's any issues, you can deal with that. You can call them at 1-800-518-GRANT. You can work with them to get that resolved. You do not want to have done all that work and then have it fall out of the system at the last moment. So you do have until June 17th, but don't wait until then. Okay, so now that we've covered that. There are some funding limitations and restrictions. No more than 20% can be used for data collection or performance measurement or performance assessment. Be sure that you identify the things that you're going to spend your money on in your budget. Keep in mind your budget's not scored as part of your application, but you do have to submit one as part of your package. Okay, so let's pause for a moment and see if you have any questions about the application, like material, like the actual like components that need to go in, and the submission process and how you do that. So Lisa, would you open the lines for a moment?
Again, if anyone does have a question, make sure to press *1 and record your name. Again, that's *1. I'm showing no questions.
Okay, thanks. I'm just replying. Someone had a question about the question about how to get into the line. So I'm just responding to him so that he's at least got the phone number so that he can hear us. Hopefully he'll be able to join us. And again, if you come up with other questions, just you can put them in the Q&A box if you think of anything after we've moved on, so don't worry about that. Okay, so let's talk about how your application is actually going to get reviewed. What kind of things are people looking for? What's important to them? Okay, so it's going to be reviewed and scored according to the quality of your response. Your project narrative can be no longer than 30 pages, and this is really your opportunity to explain the situation in your community and propose what it is you want to do. You have to use the headings that are identified, and I'm going to go over those in a moment, and you have to place the information in the right section or they can't consider it. And it will be scored according to how well you address the requirements for each section. The budget will be part of it, and your supporting documentation is part of it, but the sections A through D is really where you get your score out of 100. So you really want to take your time with this, make sure that you've addressed everything that's being asked for. Okay, so Section A. This is the history and the current situation in your tribal community, and it's for 15 points. You have 5 elements that you need to focus on. The first question is, what is your 10-year average suicide rate among your young people aged 10 to 24 for the last decade? And you want to include the certificate of eligibility that basically certifies you in your community as having that rate. And if you're a consortium and you're representing multiple communities, then you have to be able to demonstrate that the rate is above the needed average in order to qualify for the grant. And so make sure you include that certificate of eligibility with your application, because not only do you have to be a tribal organization, or tribal consortia, you have to have the 13.88 per 100,000 rate. We want to know, what is the impact of suicide attempts and clusters on your community? Talk about what your community is made up of in terms of your demographics, including any historical context, so things like relocation or language loss, the loss of traditions, things like that. That's important for us to understand, not just the people in the community, but also how did things become the way they are? How did we get here? We also want to hear about what is currently going on in your community as far as suicide prevention or substance abuse prevention or mental health promotion. Talk to us about the current status, and then tell us about stuff that's missing. What's not there? What needs to be there? What disconnect exists between what you've got and what you actually need to have? Because that's going to help us understand what you're actually going to propose to us for this grant. So any questions about the Section A, history and current situation in your tribal community? Lisa, do we have anybody in the queue?
I'm sorry, I was muted. I thought I unmuted.
That's okay.
At this point, we do not. Again, at any time, you can put your name in the queue by hitting *1 and recording just your name. We do have one from one moment.
Great.
Oh, can you hear me?
Yep, we can hear
Rod,
you.
your line is open.
Okay, thank you. We're from Nambe Pueblo. I want to ask you, what is the eligibility, certificate of eligibility?
That's included at the very back of the RFA. There's a sheet. It's on page 52. It's Appendix H.
Okay.
And that's where you have the signatory sign off that you have a 10-year average rate of 13.88 per 100,000 or higher. So that is already included in the RFA, and we just need you to certify. You have to have somebody sign that, certify that for us, and send that in with your package.
Oh, okay. Thank you.
You bet. Good question.
And Jennifer, your line is open.
Hi, this is Jennifer Reese. I'm from Fresno American Indian Health Project. And I just had a question going back to eligibility. We are an urban Indian health program, but we're looking to partner with some of the local area tribes, and as long as the tribe is applying, I wanted to make sure that was okay.
If that would make you into a consortium of tribes, then that would be fine. Because tribal consortia can apply.
Okay, thank you.
Yep.
And I'm showing no further questions.
Okay, those were good ones. All right, we're going to move on to Section B. All right, Section B is a big one. This is 35 points, and this is your proposed approach in year one. You have 5 elements, and this is, you can see, you'll see why this is worth 35 points, because it's a major section. You want to describe your community vision for suicide prevention, substance abuse prevention, and mental health promotion. Are you going to be focused on the universal, selective, or indicated prevention activities? Remember the butterflies, are you going to do the sky of butterflies up to age 24? Are you going to do the selective butterflies that are identified at risk, or the indicated butterflies that are going to need the follow-up services and monitoring to get them to the services that they need? Are you going to do 2 of those 3? Are you going to do universal and selective because indicated is already being handled in your community? Are you going to do selective and indicated because there's already people doing universal interventions? Or are you going to do all 3? So just tell us, and this, again, this goes back to the earlier section of what's already going on in your community. So how's this, what you're proposing, how's that fit into what else is going on? And we know that there are positive things happening in tribal communities all over the country. We know that. We know that there's amazing stuff happening, and so we want to understand how can what we're going to do with this program, how can that help support that? How can we fit in and help connect some of these dots? So connect what you know now about your community to what you'll anticipate this funding could do for you in years 2 through 5. So once you've thought about what your focus is going to be for year 1, you're going to do the hiring, you're going to put in those protocols, you're going to determine what the standards of care are going to be, you're going to make those connections and make sure that everybody's on the same page. And then for years 2 through 5, what kinds of activities are you going to do in these different tiers, and why are you going to focus on that? What benefit do you anticipate that's going to have? Talk about your year 1 efforts. Talk about how you're going to get community involvement. How are you going to, work to make sure that people are on board? How are you going to develop or revise post-vention protocol for suicides, attempts, and clusters? Meaning, how are you going to respond when you know there's a suicide emergency in the community? What happens when a youth is identified at risk for suicide? How do we take care of that youth? What happens right away? And does everyone know what they need to do? So if you have those protocols already written, how are you going to update them? How are you going to make sure they're solid? And if you don't have them, that's okay, but we want to know how you're going to develop that, because that's a year 1 requirement. Same question for the follow-up. So once a youth is identified, What's the protocol to follow up with that youth? Make sure that they're getting the services that they need. Let's say they come up with some other things. Let's say that they need recovery support. What happens for that youth? How do they get the services and what's available to them? So there has to be a protocol, and it has to be something that everybody across those agencies in the community understands what's expected from them. And so you're going to either develop or revise that in year one. That's a requirement. And then what's your timeline for accomplishing those goals in year one? So my encouragement to you is to think carefully about year one. Notice what the focus is. It's on developing your processes, your procedures, your standards of care. What are you going to do in the case of a crisis? What are you going to do for follow-up for youth that need that? You're going to conduct a needs assessment, a readiness assessment. You want to think about that focus in year one as infrastructure in relationship to the focus for years 2 through 5. And the tendency for grantees sometimes is they want to jump right into activities. Oh, we're going to do American Indian life skills. We're going to do equine therapy. We're going to do Project Venture. We're going to do all these things. But that means that you haven't thought through what your year one is. Your focus needs to be on how are you going to make sure that this hard work in year one is going to be done so that when you implement these activities in years 2 through 5, you have a solid foundation to work from, and those youth are going to we're going to make sure those youth are cared for. So any questions about Section B, your proposed approach to year one, that's worth 35 points?
Again, press star 1 if you have a question and record your name. And I'm showing no questions.
Okay. Well, I must be doing all right then. Okay. So let's move on to Section C. These are the people that are going to do this work. Who are they? This is worth 20 points. Talk about what is their capability and experience in terms of the organization that it's going to be, that's going to be the point, the hub, the main hub to coordinate this effort. We want a list of the staff positions for that project, including the project director and the other key personnel, and we want to know what their demonstrated experience is in this area. Suicide prevention, substance abuse prevention, mental health promotion. Who are they and why are they best suited to do this work? So there's some resources in the RFA for you. Appendix D has some information about what should go into the biographical sketches and the job descriptions, so you don't have to make it up. You can see what we're looking for in those sketches and descriptions. And just a little piece of advice for you, regardless of your approach, we highly recommend that you have a full-time project director to oversee Native connections in your community and to lead that initiative and not to split time between that project and another. We really encourage you to have a full-time, 100% full-time person project director for Native Connections. Any questions about Section C, staff management and relevant experience?
Give it just a moment. Debbie Evans, your line is open.
Hi, Debbie.
Debbie, your line is open. You may have muted yourself.
Uh-oh.
Go. Debbie, are you there? Debbie, did you have a question? Yeah, I'll clear the question. And that was it.
Oh, all right. Okay. Section B. Measures of progress and improvement, and this is 30 points as well. Not as big as Section B, but still something that you're going to want to make sure you think carefully about. You have 4 elements here. And this is the section where we want to understand, how will you know that what you're doing is working? What kind of information are you going to be gathering that's going to help you determine that? And we're going to be asking you for some information over the course of the project to track on the progress that you're making. But we really want to know, what is your current ability to collect and report on the measures that we talked about? Remember that blue wheel that I showed you that had all the different elements, things like how many organizations are working together now, how many new services are available, how many youth are getting follow-up after a suicide attempt, how many are you reducing your substance abuse-related emergency department visits, are you reducing the number of suicide attempts and completions? We want to know what's your ability now, currently, to get that information. And then we want to hear from you about how will you use that to improve your project and make sure that the goals and objectives are going to be tracked on and your progress measured and your goals ultimately achieved. And this one's an important one for tribal communities. How are you going to convey the outcomes that you're getting to your staff, your tribal leadership, and your stakeholders? When your tribal leadership knows what's going on in your community and they see that things are changing and things are improving, then they're going to be much more likely to support what you're doing. And we recognize that this is a slow process. It takes time, and these things, that's why it's a 5-year grant, because we understand change is going to happen slowly. But when you front load that good work in that first year and you get all that good foundational work done, it makes years 2 through 5 that much easier. And so if you're able to make those relationships happen in the beginning and you keep them posted, you're going to find that your grant program is going to run pretty smoothly. And then we want to find out, what is your plan for conducting your local performance assessment, and what is your current ability to conduct that assessment? So page 10 has a little bit more information about that. So that's Section D, the measures of progress and improvement, and that's 30 points. So any questions about Section D before we move on?
Looks like Debbie's line is back in there. Debbie, I'm going to open you up again.
Can you hear me?
Yep.
Okay, my question is for the previous section. I wanted to know if there is a percentage cap on personnel salaries for this project. If you have a full-time project director, is there a limit as to how much they can be paid?
No.
Okay, thank you.
No, they don't review salaries as part of the application. That's just, we're really interested in the budget and stuff. That's not scored, so that's not part of it.
And there are no other questions.
Okay. Okay, so speaking of things that are unscored, these elements are unscored. Your budget, the existing resources, things like if you have a recent community readiness assessment, that's something you can share with us. If you have post-pension protocols that are already in draft form, if you have a follow-up protocol, if those things exist, then you can send them to us, and we want to see them because that's important information. But the reviewers are not going to consider that as part of your application. You won't be scored. So please don't worry if you're sending in a community readiness assessment and it has, a score of 2.1. Please don't feel like you're not going to be penalized for that. That's actually really good information for us to add because we want to understand that that's where the community is on this topic. So please don't hesitate to send that stuff in. It's actually really helpful for us. Literature citations, if you cited anything, those aren't scored. The biographical sketches in your job descriptions, not scored. Confidentiality and SAMHSA, participant protection. These things are things that you need to include, but they are not something that the reviewers are going to be scoring, and they're not going to count that stuff against you, even though it's a required part of your application. So here's some examples of some of the things that I was just talking about for Section 8. We want to understand, where does suicide prevention and substance abuse prevention and mental health promotion fit into the current priorities of your tribal leadership. And so we want to know, what are some of the past efforts that have been going on in your community to help us sort of get the full picture? Have you conducted a community readiness assessment in the last 18 months on suicide prevention, substance abuse prevention, or mental health promotion? Include any existing drafts of your protocols. And again, these are helpful for context, but not scored. Okay. Review and selection process. Applications are peer reviewed according to the sections that I talked to you about. And the decisions to fund are based on the strengths and weaknesses of your application identified by peer reviewers. There's going to be a process where the CMHS National Advisory Council will have an opportunity to hear who is proposed to get funded. It's based on the availability of funds. Sometimes, you know, things happen and we're not able to go through with a grant program, and this is a new one, but we're hopeful that that would not be the case here. It's very rare that that happens, but it is a possibility, and that we want to make sure there's an equitable distribution in terms of geography as well. And it's important to know that the SAMHSA Grant Review Office, they get peer reviewers and they facilitate the review process and the scoring, not me. I am the project coordinator for this project for Native Connections for these grants, but I am not actually the person who's going to be reviewing your application. So please keep that in mind. This is a confidential process that happens through grant review, and I have no influence on that process whatsoever. Okay. As far as when the awards are made, the award notices will be mailed from SAMHSA. They will be mailed from the Grants Management Office, and you will also get notification from Grant Review if you are not funded. This will go to your business office. Whoever you list on the business office side for your grant application, that's who gets the notification whether you've got funded or not. The date for the release of the funds and the notification is to be determined. It depends on a number of factors, so we don't have any kind of confirmation on when that information will be coming out to you, but we do know that the anticipated start of the grant funding is no later than September 30th, 2014. So just some other things to keep in mind. There are terms and conditions and administrative compliance requirements, so please be mindful of those. You'll see those when you go to the SAMHSA.gov website. Keep in mind that you can't use grant funds to supplant current funding of existing activities. And what I mean by that is that you can't replace funding of a recipient's existing program with funds from this federal grant. Okay, so this is a new initiative. This is designed to be a new effort in your community rather than simply take the place of other funding that's happening. And then there's reporting requirements as well, and the grants website for SAMHSA.gov has more information for you about that. Typically, there's an annual report. There are data reporting requirements that you need to do on a quarterly basis. You will be in touch with your project officer, it might be me, on a monthly basis so that we can keep track of how things are going and that you have access to technical assistance and support to help you with your program. So you're not in this by yourself, and the reporting isn't just for accountability. It's also so that we can see how things are going and help with any spots that are hard or that are causing some difficulty. These are things that we can help with, and so the reporting helps us help you in a lot of ways. And that's my information there on top. I'm Michelle Carnes, and that's my phone number, and that's my email address. It's also in the RFA, so if after today's webinar you think of other questions, you're certainly welcome to reach out to me. If you have any questions on grants management or budget issues, that salary question is a great question. That would be something that you want to ask to Gwendolyn Simpson, who's just on the floor right above me, and that's her contact information there. So when you think about it, like I'm sort of the nuts and bolts program person, and if you're thinking about a dollars and cents question, then you'll want to reach out to Gwen. These are some of the standard boilerplate things that you'll provide to us. These are all the appendices at the end. There's a checklist. There's a guidance for the electronic submission, and that includes the waiver request process if you'd rather do a paper application or if you really need to do it that way. Funding restrictions are also articulated there. There's the information for your biographical sketches and your job descriptions. There's a sample justification and a budget there for you too, so you can see that as a guide as you put yours together. And then some information about confidentiality and participant protection. We want to make sure that everybody is clear about, you know, what and on the same page about what we're asking folks to do in terms of data collection. You know, suicide and substance abuse. You know, these are difficult topics sometimes. We want to make sure everybody's on board with what's going on the data side. And then you've got your two appendices, G and H. And just as a reminder, Appendix G is your worksheet to calculate your average suicide rate. Again, if you're a tribe, one tribal community, then you just need to report your rate for that community. If you're a consortium working with multiple communities, then you'll want to make sure that you calculate the rate. You actually want to list each of them and then do the average to see if you're eligible to apply for this grant. And the details are available there for you on Appendix G. And then your certificate of eligibility is page 52. It's the very last page of the RFA in Appendix H, and you'll submit that with your grant application. Some have asked me about how they get access to data in order to calculate their rate, and we recognize that tribes have different ways of collecting data. Some of you may want to reach out to your tribal epicenter. Some of you may want to talk to your tribal health administration. There's different ways that that's done in different tribal communities, and so the best advice I can give you is to reach out to the folks who collect data for you or have health-related data, behavioral health data, whatever that looks like in your community, and have that person do your certificate of eligibility for you so that you can have something that states what your average rate is for the past 10 years, and that will tell us if you're eligible for this grant program. So once again, summary of the important information. Thanks to the caller that let me know this good news that the applications are actually due June 17th. That's really awesome. I'm really glad that we're going to have some extra time. We worked hard to get that extra time, so I'm glad that that happened. It must have just happened. We will do up to 20 awards, and they will be up to $200,000 a year. There is no match required. They are up to 5-year grants. And eligibility is federally recognized tribes and tribal organizations, tribal consortia, with an average 10-year suicide rate of 13.88 per 100,000 for your youth in your community between ages 10 and 24. Any final questions about the Native Connections RFA?
And again, if you joined late, if you do have a question, you can hit *1 and record just your name at the prompt. One moment. At Cascola, your line is open. I think you're muted.
Oh, sorry, I was going to ask for a match, but it looks like there's no match.
There is no match.
Okay, thank you.
You bet.
One more question, one moment. Donna, your line is open.
Hi, could you repeat the web address for a copy of the PowerPoint slides?
Sure. Thank you for doing that. It is sprc.org. In fact, what I'll do is this. I'll get the link and I'll post it in the Q&A. Let me do that.
Thank you.
Diane Simmons, your line is open.
I had trouble getting into the computer webinar, and I joined just the audio late. Is there an access to the recording?
Yes. I am actually, let me see here. Let me figure out how to. Ooh, here we go. Check this out. Okay. Ooh, no, I don't want to do that. Hold on. Let's see here. Text page. Here we go. Yay! Can you guys see that? Do you see that link?
Yes, we can't see anything.
Okay. Maybe it's not working. Hold on.
Hello?
I'm here. I'm trying to figure out how to show a link. Hold on just a second.
I think her question is that they aren't even able to see the slides at all, right, Diane?
Correct.
Right, but what I'm saying is that there's a link, and if you go to sprc.org on Monday or Tuesday next week, it will be posted under a tab that says SAMHSA webinars. But what I'm trying to do is I'm trying to give out the link on the actual screen for the rest of the folks that do have the slides, just so they can share it with other people if possible.
Well, what I'm wanting to know is, will there be the purple along with the PowerPoint?
Yes, everything will be there. So it won't just be a PowerPoint file. It will actually be the recording of what we're doing right now.
Okay, great. Thank you.
Yeah, so you'll be able to see all the links. You'll be able to literally you'll be able to replay everything that we're doing right now.
Great, thank you.
Yeah. And I apologize, I'm not able to figure out how to put a link up there, but it's sprc.org, and the tab is the SAMHSA webinar tab, and it will be the first one on Monday or Tuesday next week.
All right, and Marlene Adams, your line is open.
Yes, hello, can you hear me?
I can.
Okay, good. I'm calling from Alaska, and I apologize, I wasn't able to get on the webinar, but was able to get on the audio. And my question is in reference to, like, there's a minimum size of a community that you work with?
No.
Okay.
No, because some Alaska villages are quite small, but some of them are the ones with the greatest need and have the highest rate, so no.
Okay, thank you very much.
Sure.
And that was the last question.
Great. All right. Well, here's a final piece of advice and resource for you. This is a great resource if you've never seen it. There is a tribal youth program at the Office of Juvenile Justice and Delinquency Prevention, OJJDP. This is a toolkit for tribes to help in the grant writing process. And it's not specific to Native Connections, but it can help you write, a number of different applications, and it can help you with this one. And so for those of you online, or those of you who are just on the phone, it's www.tribalyouthprogram.org, and there's a tools section that you'll go to, and it's an online guide to preparing coordinated tribal assistance solicitation. So if you do a search for tribalyouthprogram.org, then you can come up with those resources online to help you put this application together. It's an excellent, excellent toolkit, and I highly recommend it, not just for this program, but any program that asks you to focus on tribal need in the application. And after you sent it in, obviously, hope for a good score and you want to get an award, but don't let your efforts stop if you're not funded, because the process of developing and writing the Native Connections application can plant the seed of systems connection and systems change. Just by going around and gathering this information and working to put the application together, you can actually start this process just by doing that. And so with leadership and commitment, you can use your existing resources and community support to start incorporating the ideas of Native Connections so that by the time you find out if you're awarded, then you will be primed. You will be ready to go to really hit the ground running, and that's a great thing. That's a wonderful thing for your community. And so obviously, you want to get a good score and you want to get an award, but keep in mind that just going through the process of putting this application together is moving your community forward, and that can generate momentum, which can be really useful and helpful apart from Native Connections, whether you are funded or not. And so once again, my information's right there on top, and then if you have budget information, dollar and cents questions, then you can reach out to Gwen Simpson. And let's open up the line one more time and see if we have any final questions before we wrap up for today.
And if you do have a question, press *1 and record just your name at the prompt. And I'm showing no questions.
Okay. Well, hopefully this was a very helpful webinar for you. Hopefully you were able to get some clarification around what the intention of this program is and what it's designed to do. We're really excited about it, and I'm really looking forward to seeing your applications. Again, I have no role to play in the selection process. I only see the ones that get awarded. So I'm really looking forward to seeing what's going on in your communities and the ways that we can work together to help make things better for youth in your communities, because that's really what it's all about. I appreciate your time today, and again, please do share this webinar with your colleagues. It will be up on Monday or Tuesday next week on the sprc.org website. Have yourself a great weekend, and thank you very much.
That concludes today's conference. Thank you for participating. Please disconnect your lines at this time. Thank you.